Hi guys, welcome back to channel Dimensions of Anatomy. I am Dr. Aravinth, and in the next 3 videos we will be discussing the anatomy of larynx. This video is the first in the series on larynx, and in this video we will be seeing the cartilages, joints and ligaments of larynx. Larynx is the organ for phonation and passage of air. It is situated at the anterior midline of neck, extending from the root of the tongue to the trachea. In adult male, its position is in between third and sixth cervical vertebra. In females and children, it is at a slightly higher level. The diameter is 3 mm in children and about 12 mm in adults. Length is about 44 mm in males and 36 mm in females. The male larynx grows rapidly and becomes larger at puberty. That's why there is a change in voice of the boys at about the age of puberty, which is normally referred to as breaking of voice. Okay, moving to the anatomy proper of the larynx. The framework of larynx is made up of cartilages connected to each other by joints, held together by ligaments and membranes. There are also muscles which bring about movement between these cartilages. This whole setup is in the shape of a tube with a lumen inside, and this lumen, called the cavity of larynx, is lined by mucous membrane. First, we will see the cartilages of larynx, which forms the basic framework of larynx. There are total 9 cartilages which forms the larynx, 3 of which are paired and 3 are unpaired. The 3 unpaired cartilages are thyroid, cricoid and epiglottis, and the 3 paired cartilages are arytenoid, corniculate and cuneiform. So 3 paired cartilages making 6 and 3 unpaired cartilages together taking the total to 9 cartilages, which forms the framework of larynx. Before moving on to see each cartilage in detail, as usual, we have to finish our drawing ritual. We will draw the cartilages of larynx as seen from anterior, posterior and lateral views. Come on, let's get on with it. Okay, our diagram is complete. Let's see each cartilage in detail. First is the thyroid cartilage. Thyroid cartilage is V-shaped in cross section. It has a right and left lamina, each of which is roughly quadrilateral in shape. The lamina are placed obliquely relative to the midline. That is, the anterior border of each lamina approach each other at an angle of 90° in male and about 120° in female, whereas the posterior borders are divergent. So the anterior borders of both lamina approach each other at an angle. The lower part of these anterior borders are fused together to form the laryngeal prominence, often colloquially referred to as Adam's apple. I think there is an interesting story behind this Adam's apple, a mythical story. If you are interested, you can check it out in the internet. Anyways, the point is the lower part of the anterior border is fused together to form the laryngeal prominence, while the upper part is separated to form the thyroid notch. The posterior borders of both lamina project upward and downward to form the superior and inferior cornu. The outer surface of each lamina is marked by an oblique line which extends from superior thyroid tubercle to inferior thyroid tubercle. Now we have to see the structures attached to the thyroid cartilage, but I will postpone that to a later time. We will see the attachment of each cartilage after we have seen the basic structure of all the cartilages. Okay, now moving on to cricoid cartilage. It is a ring shape with a narrow anterior part called the arch and broad posterior part called the lamina. We will bring in our posterior view to see the lamina of cricoid cartilage. The broad posterior part called the lamina projects upwards behind the thyroid cartilage and articulates with arytenoid cartilage, which we will see in a short while. The inferior cornu of the thyroid articulates with the side of the cricoid cartilage. Moving on to the next cartilage in line, epiglottis. Epiglottis is a leaf-shaped cartilage, the upper end of which is broad and free, projecting behind the hyoid bone, and the lower end is pointed and attached to the upper part of the angle between the two lamina of the thyroid cartilage. Coming to the arytenoid cartilage, these are two small pyramid-shaped cartilages situated on the upper border of the lamina of the cricoid cartilage. The apex of each cartilage is curved posteromedially and articulates with the next cartilage in line, that is the corniculate cartilage. The base is prolonged anteriorly, called the vocal process, and laterally called the muscular process. The lateral projection called the muscular process you can see in this diagram, and in order to see the anterior prolongation, that is the vocal process, we will have to bring in the lateral view. Here you can see it, the base is prolonged anteriorly to form the vocal process. The body of a retinoid has three surfaces. Consider this as the cross section. As we saw, it has three surfaces: anterolateral, medial, and posterior. The last two cartilages are corniculate and cuneiform. Corniculate cartilage is the name given to two conical nodules which articulate with the apex of the arytenoid, and cuneiform refers to two rod-shaped cartilages in the epiglottic fold, that is the fold extending between the arytenoid cartilage and epiglottis. We will discuss about this fold in detail while discussing the ligaments and membranes of larynx. Okay, now let's see the attachments of all the cartilages one by one. Before that, let's add the attachments to our existing diagram of cartilages. Okay, let's start with the thyroid cartilage. The oblique line of the thyroid cartilage gives attachment to three structures, three muscles, that is thyrohyoid, sternothyroid and thyropharyngeus part of inferior constrictor of pharynx. The lower border and inferior cornu gives attachment to cricothyroid muscle. The posterior border again gives attachment to three muscles, palatopharyngeus, salpingopharyngeus and stylopharyngeus. On the inner aspect, the thyroid cartilage gives attachment to median thyroepiglottic ligament at the midline, thyroepiglottic muscle on each side, vestibular fold and vocal fold on each side, thyroarytenoid and vocalis muscle on each side. Moving on to the attachments of cricoid cartilage. The anterior part of the arch of the cricoid gives attachment to cricothyroid muscle. The anterolateral aspect of the arch gives attachment to lateral cricoarytenoid muscle. The lamina of the cricoid cartilage on the outer aspect gives attachment to posterior cricoarytenoid muscle. Coming to the attachments of epiglottis, the right and left margins of the epiglottis gives attachment to aryepiglottic fold and thyroepiglottic muscle. The anterior surface of the epiglottis is connected to the tongue by median and lateral glossoepiglottic folds and hyoid bone by hyoepiglottic ligament. Moving on to the attachments of arytenoid cartilage. Vocal process gives attachment to vocal fold and vocalis muscle. Above the vocal process is attached the vestibular fold. The muscular process on the posterior aspect gives attachment to posterior cricoarytenoid and on anterior aspect gives attachment to lateral cricoarytenoid. The posterior surface of the arytenoid gives attachment to transverse arytenoid, whereas the lower part of the posterior surface, that is the base, gives attachment to oblique arytenoid, which continues also as aryepiglottic muscle. I think already you might be thinking the attachments of laryngeal cartilages is a bit difficult. Don't worry, believe me, even though it feels a little overwhelming now, it will all be very clear and easy once we finish the muscles of larynx, especially the origin insertion portion. So we will leave our attachments here for the time being. We will sort this out during our class on muscles of larynx. Now let's move on to the laryngeal joints. The first joint we will see is the cricothyroid joint. The cricothyroid joint is a synovial joint. The articulating surfaces are the inferior corner of thyroid cartilage and the side of the cricoid cartilage. The movements occurring in this joint are rotary movements around a transverse axis. The axis is shown here. Rotary movements around a transverse axis which permits tension and relaxation of vocal cord. We know that the vocal cord is attached to the inner aspect of the thyroid cartilage. The other end is attached to the vocal process of the arytenoid. So any rotary movement in a transverse axis at this joint allows tension and relaxation of the vocal cord. Apart from this, there are some gliding movements also. The next joint is cricoarytenoid joint. This is also a synovial joint. The articulating surfaces here are the base of the arytenoid and upper border of the lamina of the cricoid. The movements permitted are, it allows rotary movements around a vertical axis shown here, which permits adduction and abduction of the vocal cords attached to the vocal process. It also allows gliding movements in all directions. Moving on to the next section, the laryngeal ligaments and membranes. The laryngeal ligaments and membranes are divided into two groups, extrinsic and intrinsic. The extrinsic group includes thyrohyoid membrane, hyoepiglottic ligament, cricotracheal ligament. And the intrinsic group includes fibroelastic membrane of larynx. Now we will need to add these ligaments and membranes to our existing diagram of laryngeal cartilages. We will do that now. Okay, let's see the extrinsic ligaments first. The first ligament is thyrohyoid membrane. The thyrohyoid membrane extends from the thyroid cartilage to the hyoid bone. The median and lateral parts of this is thickened to form median and lateral thyrohyoid ligaments. And this membrane is pierced by internal laryngeal nerve and superior laryngeal vessels. The next extrinsic ligament is hyoepiglottic ligament. It extends from the upper end of epiglottis to the hyoid bone. The next one is cricotracheal ligament, which extends from cricoid to the trachea. Moving on to the intrinsic ligaments. As we saw earlier, the intrinsic ligament is one broad sheet of fibroelastic tissue known as the fibroelastic membrane of larynx, which is placed just outside the mucous membrane, that is between the cartilage and mucous membrane, inner lining of mucous membrane. This one broad sheet of fibroelastic tissue is interrupted on each side by a gap called the sinus of larynx. The part of the sheet above the sinus is called quadrate membrane, and the part below the sinus is called conus elasticus. The quadrate membrane extends from the arytenoid cartilage to the epiglottis. The lower free border is thickened to form the vestibular fold, and the upper border is thickened to form the airy epiglottic fold, which you might remember we came across at least twice before. The conus elasticus extends upwards from arch of cricoid. The anterior thickened part of this is called the cricothyroid ligament. The upper free border is thickened to form the ocal fold. Okay, we will finish this session here. We will see the cavity of larynx and muscles of larynx in subsequent videos. If you like my class, do hit the like button. For the follow-up videos and more, keep the channel subscribed. As always, PDF notes are available for download at the link in the description. For further guidance or classes, mail me. Thanks for watching. Bye.